is Sandra Sarah. I am doing my assessment video for Unit 5. I am going to start with the neck, which is going to include the lymph nodes. We're not going to do the neurological system or any of the cranial nerves or the head that was done in my previous video. So I'm just going to start with the neck and we'll work our way down from there. First I'm going to inspect the neck for any deformities. Palpate, yes, trachea. I'm going to come around and feel for the thyroid. My hands aren't cold, I know, I'm sorry. Palpate the thyroid. Come back around. I'm going to do all of the lymph nodes, starting with the pre-auricle, post-auricle, occipital, tonsillar, submental, submandibular, slide this down a little, subclavicular, and then anterior cervical, and the posterior cervical. Okay, and we're going to move down into the anterior chest. First thing we're going to do is inspect the skin for color, pink, texture's good, hair distribution is normal. Good. Alright, so we're going to inspect the posterior chest. First we're going to start and look at the skin. We're going to do the color, warm, it's pink, there's no moisture, there's no edema, there's no bruising, texture's smooth, there's no scars, skin lesion, there's no nevy, other than a few freckles here and there. There's no respiratory distress, patient's breathing easy, not using any accessory muscles, there's no deformity. Can you take a big breath? Just normal chest rise, symmetric, and listen to lung fields. First I'm going to have you big breath, symmetric chest expansion. I'm going to palpate for any chest vibration, for any tactile fremitus. Sorry, cold. I'm going to concuss over the posterior lung fields. Good. I'm going to auscultate lung field. Take a big breath. There. Again. 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 Big breath. Okay. Good. I'm going to have you, I'm going to test the egophony. I'm going to have you say E.
E.
E. Again.
E.
E. Say 99.
99.
Again.
99.
And can you whisper some words? And again. Good. Okay. And we're going to go around and we're going to go inspect the anterior chest. Anterior chest again, hair distribution's normal, skin's warm and dry, it's pink, no lesions, scarring, no bruising, texture's normal. Take a big breath. No obvious deformities, it's symmetric. Again, big breath. Sorry. Big breath. Okay, we're going to auscultate the anterior sound. Big breath. Again. Big breath. Big breath. Okay, so then we're going to move on to the heart. Okay, so we're going to assess the valves of the heart. We're going to do the aortic. Over there. Good. We're going to do the pulmonic. Tricuspid. Alright. Then the mitral valve. And the Erb's point. I'm going to listen to the apical pulse for a full minute. Good, normal rhythm, normal rate. I'm going to palpate the PMI. There. Alright, I'm going to have you lie down. I'm going to look for any heaves or lifts. Put your hands down to your side. Again, we're going to auscultate. For any thrills. Again, over each area. Gonna palpate for any thrills. I'm going to put the head of the bed up about 30 degrees or so. Assess for any JBD here in the neck. Can you turn your head a little that way? Good. And have you turn back this way. Good. No JBD noted. And back up. Alright, then we're going to move on to the abdomen. Again, we're going to inspect the abdomen for color, moisture, texture, any edema, any lesions. Temperature's warm and dry. Turgor's good. No bruising, no scars, no birthmarks. Just a couple of freckles there. Symmetry is normal. I'm going to auscultate for any bruits over the arteries. First, we're going to start with the aortic. The renals on both sides. The iliac. Again, both sides. And then the femoral arteries here. Again, on both sides. Gonna listen to bowel sounds in all four quadrants. Again, I'm gonna percuss the abdomen for any tympani or dullness, excuse me, or flatness. Gonna palpate for any masses or tenderness. Gonna palpate the spleen. No spleen found. Gonna palpate the liver. sit up real quick and palpate for any CBA tenderness. Any pain here?
No.
Here also.
No.
Okay, lie back down. Alright, I'm going to have the patient sit up. We're going to inspect the upper extremities. First we're going to start with the joints, which each joint we're going to inspect for redness, any deformity, any swelling, any nodules. We're going to make sure they're symmetric, any tenderness, any crepitus. So I'm going to do that for all the joints of the hand, the wrist, the elbow, and also the shoulder, that we would check all the joints for all of those. As far as the hands, we're going to check, we're going to check for, palpate any capri fill. I'm going to assess the radial pulse. We're going to check range of motion for the fingers. We're going to do flexion and extension, in and out, adduction and abduction, opposition. Good. We're going to do the same for both hands. And then we're going to go to the wrists. Again, we would check for all the redness, tenderness for each of the joints. We're going to check down, good, and up, good, and in, okay, good. Hyperextend, good, wrists, ulnar deviation. Alright, so again with the wrist, we're going to inspect the joint for any redness, tenderness, crepitus, swelling, deformity, nodules, symmetry, and both are normal. So we're going to do abduction and adduction, bend down and up, good, straight. Okay, there's no ulnar or radial deviation noted. And then we would go, this radial pulse is good. Test the hand grips. Can you squeeze? Squeeze. Ah, okay. 5, strong. Okay. We're going to go to the elbow. And again, we would do the same for both sides of the body. So we're going to go to the elbow. We're going to, again, assess the joint. And then do any flexion and extension. Good. Any against resistance. Pull back. Okay. Good. And then the shoulder. Again, we do the same for the other elbow. And then the shoulder. I'm going to inspect and palpate it. Assess for any deformities, redness, swelling in the joint. Arm out. Go in. Good. You go behind. Not so good.
Not so good.
Not so good. Cross this way. Okay. Up. That's your bad shoulder. Okay. Okay. Alright, good. That's for strength. Pull back. Good. This one, go back, and we're going to assess for light touch, the shoulder area. Feel this? Good. Feel that?
Nope.
Good. Okay. Okay, so we're going to assess for the cerebellar coordination. First, I'm going to have you put your hands out. On here, you do flip them back and forth, back of them, both. Good. Good. Okay, next I'm going to have you. I'm going to put my finger out. I want you to take your finger, touch my finger, and then touch your nose. Back. No, yeah, that one. Again. You're failing. Okay. Good. Okay. And then, so we're going to assess the sterogonus. I'm going to put some, if you can close your eyes, I'm going to put something in your hand. If you can tell me what it is.
Okay.
Good, okay. And then we're going to assess the graph of draw, close your eyes. I'm gonna draw
Close.
like a number in your hand. If you can tell me what number it is.
With a 5.
5, good. Do the same on this hand.
That was a 5.
Good. Okay. All right. Then we're gonna move down to the legs. We're gonna have good. Okay. So we're gonna assess the lower extremities. Each joint, the hip, the knees, the ankles, and the toes, we would assess for any redness, swelling, any deformities, any nodules, crepitus. Make sure they're symmetric. We're going to test range of motion for each of them. First, we'll start with the hip. Can you flex your leg up? Good. Go out. Okay. Again, we would assess both legs, not just the one. And the knee. Good. Okay. And then, again, the knees, any redness, tenderness. Go down to the ankles. Check for palpable pulses. We're going to check the toes. Can you flex your toes down? Good. And up. Good. Good. And your ankles go out. And okay, how about up? Perfect. How about against? I'm going to have you push against my hands. Good, good, good. Okay. Just I'm going to tell you if you feel me touching you here. Feel me touching you here. Good. Feel me touching you here. Good. Have you? Good. All right. I'm going to have you stand up. Again, we're going to inspect all the joints with the patient standing. Be able to lift your legs straight out. Good. How about behind? Okay. How about your knee up and out? Okay. Can you do both legs? No. Good. There's no external rotation. The legs are symmetric. Okay, so I'm going to go from behind. We're going to inspect the spine for any curvatures, check for alignment, any scoliosis, which there's none. And have you lean forward. Lean forward.
Yeah.
Good. Okay, back. Are you able to bend back? Good. Have you rotate, turn your side, and then to the other side. Good. Range of motion is normal. Have you do the Romberg test. I'm going to have you close your eyes. I have to turn this way. Stick your hands straight out to the side. Good. Feet together. Okay. I'm going to have you, if you can, just walk towards the door over there.
Can I open my eyes?
Open your eyes.
Okay.
Gait is steady. Come back. There's no swaying. And turn. Are you able to hop on one foot? Okay, now the other. Okay, good. Alright, patient has normal posture. Was able to maintain his posture. And that is the end of the video.